Good morning, everyone. I'm honored today to introduce our Grand Round speaker this morning, Dr. Timothy O'Leary. But I do have to acknowledge that this is also bittersweet, as he is the last speaker to be invited by Dr. Debbie Powell for our Education Grand Rounds. Throughout his career, Dr. O'Leary has been a leader in a variety of different areas in pathology. After receiving a PhD in physical chemistry from Stanford and an MD from the University of Michigan, he went on to complete a residency in anatomic pathology and a fellowship in chemical physics at the NIH. In 1987, he became chief of the Department of Cellular Pathology and Genetics at the AFIP. And during his 17 years at the helm, he became very involved in the then new and rapidly developing field of molecular genetic pathology. He's also held a number of governmental leadership positions, including at the FDA, where he was director of the Division of Immunology and Hematology Devices, was on the Pathology and Hematology Devices panel, and served on the HHS Clinical Laboratory Improvement Advisory Committee. He also served over a decade as Chief Research and Development Officer in the VA, overseeing a nationwide research program involving over 100 VA medical centers. And he's currently an adjunct professor of pathology at the University of Maryland School of Medicine. Dr. O'Leary has published extensively, including over 200 journal articles that are notable really for their very wide-ranging subject matter, including, but not limited to, anatomic pathology, including characterization of gastrointestinal stromal tumors, improved methods for tissue processing, particularly to enable genomic and proteomic analysis of FFPE tissue. He also holds 4 patents related to tissue processing for such testing. He published early studies on the use of telepathology and digital pathology. He's also written of his role in the development of a mega biobank, the Million Veteran Program, to study genetic influences on health and disease. He's also written on the comparison of various statistical methods commonly and sometimes incorrectly used in the medical literature. And it's also contributed to the burgeoning literature on the role of AI in molecular pathology. In fact, his work has likely even impacted my clinical current practice by his studies 25 years ago of automated chromosome identification, which is now routinely used in cytogenetics. His has been a consistently strong voice advocating for setting higher standards for methodological and statistical rigor in published literature. And during his 5 years as editor-in-chief of the Journal of Molecular Diagnostics, these practices firmly established it as a top-tier journal. And attesting to the esteem in which he is held by his colleagues, Dr. O'Leary was elected president of the Association for Molecular Pathology in 2016. His talk for today, Leadership and Professionalism in Uncertain Times, a Personal Perspective, might seem an unconventional topic for an education grand rounds. However, those of us involved in undergraduate and graduate medical education, as well as the leadership of clinical and research labs, so essentially all of us attending this talk today, know how critical these skills are. So thank you, Dr. O'Leary, for being with us this morning.
Thank you for that extremely kind introduction. I think I want to meet that guy. He's not me. But I would agree with you that leadership is critical for the pathologist. There is no job in pathology, and indeed I would say in medicine, that doesn't require leadership skills. And no person really in society that should fail to be a leadership role in some way or another, because we all know something about something and none of us knows something about everything, and we need guidance no matter what our role in society is. I want to know, I'm having trouble advancing the slide now. Okay, there we go. I want to dedicate this to Deborah Powell, who invited me. We had a very short acquaintance, really less than a year, but found that we had many things in common, including a common residency at NIH. I think she's a great leader. Anthony Kleen, who I also think is a great leader, and I'll show why in a moment, and Mike Steffes, who was kind enough to have me spend 6 months with him on sabbatical back in the early 1990s. Now, you all know about Deborah Powell's history. I'm not going to go in it for a long time, but she led in so many ways, and her career is one that's really worth thinking about, because while she was a pathologist, she always retained an interest in general medicine, and she had a particular affinity to looking for competency, and I think she viewed her advocacy for competency-based training as perhaps her greatest legacy. Tony had many leadership roles, including co-founding the Association for Molecular Pathology. And for this, I'm particularly grateful because it was my professional community throughout my career. He moved around a bit, and he has a town in Texas named after him. And then Mike Steffes, who didn't move around, but managed to have board certification in more boards than I could almost count, and really a pioneer in quantitative analysis of renal disease, as well as just a really nice person. So I want to thank all three of these for their impact on my career. What do they have in common? Well, they chose a great medical specialty, as you did pathology, because it's a team sport. Each of them tried to do things that would improve healthcare. Each was willing to learn new cultures, new disciplines, and new approaches. Each was engaged with professional community made up of people working towards a common goal, and each was an innovator. And I think these are really great leadership qualities that we could all attempt to emulate. I'd also like to mention a few other leaders that we might not think of as being leaders. George Washington Carver, you've probably heard about, leader in the Tuskegee Institute. I believe he was the first PhD from the University of Iowa, but my memory may be faulty here. Mildred Dresselhaus, the first woman to be the head of the American Physical Society. John Wooden, a basketball coach whose team, the UCLA Bruins, won, I think, 9 of 11 seasons in which he was coach. They ended as number 1 in the NCAA championship. Lynn Miranda, who changed the nature of musical theater. Melinda Gates, who really was the inspiration behind the Bill and Melinda Gates Foundation. Julia Greeley, known as the Angel of Denver, who was a force in charity. Benjamin Davis, the head of the Tuskegee Airmen, and I'll throw in my wife, Diane O'Leary, who was one of the first tenured and full professors, women in a computer science department in the United States. So what does it mean to be a leader? Why are all these people good leaders? What defines them? What are the rules? Well, I'm going to tell some personal stories, mostly of times when I've fallen short. I'm going to define some skills of professionalism, and I'm going to talk about some good rules and good characteristics for leadership. Now, there are lots of definitions for leadership or a leader. George Bush said he's someone that brings people together. Napoleon said it was a person that dealt in hope. John Maxwell knows the way, goes the way, shows the way. And then Martin Luther King said, not a searcher for consensus, but a molder. So I think there are 2 core elements of leadership and professionalism. One is who you are, your nature as an individual, and what you do. And you can mold both of these. So my wife has 8 rules, which are available on the internet if you want. 1 is passion for what you do. 2, to be able to establish goals. 3, to be able to demand reasons for whatever actions you're taking, particularly when somebody else is asking you to do something. setting priorities, networking, communicating, honing your skills, and I think most importantly, get a life. And I think that's particularly important in medicine because it's very, very easy to have a hard time balancing the life we have with our job as a physician. Now, Steve Covey is a management guru. You may have heard of his 7 Habits of Highly Effective People. And his rules are be proactive, do something. And I take Tony Colleen in founding AMP. He and the co-founders of AMP decided they needed to do something. You can begin with the end in mind. And that was something that I and my colleagues did with the VA Genomic Biobank. We knew what we were wanting to do. Put first things first. Get your priorities straight in your life and in your job. Often hard to do. Think win-win. Counterexample, politics in the United States. Seek first to understand, then to be understood. Your challenge is to do this better than I do, but it is really, really important. So often we want to be understood without understanding the persons with which we're communicating. And then finally, synergize. We're all together smarter than any of us individually. And then finally, it's sharpen the saw. This is be able to put yourself together. You know, you can take a very long time to cut a piece of wood if you have a dull saw. But if you sharpen the saw, the work goes quickly. We sharpen the saw by education, perhaps by religion or meditation or social groups, a variety of different ways to make ourselves fresh for our jobs. Now, there are a few rules that I'll like to add to this. One, being in the thick of thin things. Thick of thin things is where you are doing things that really aren't important. And I have problems with this, quite frankly. You know, I make lists and there's a job that takes 5 minutes to do. It's not really very important, but I get it knocked off the list and it makes me feel good. And there's a job that's really important that takes me an hour and a half to do, and I stall on it. Not really a good process. Don't emulate me. Don't do a job below your pay grade, or you won't have time to do the stuff that only you can do. That's called micromanagement. And micromanagement is, I think, a fatal flaw to great leadership. Yes, sometimes the people that are working with us and for us will do things differently than we would do them. That doesn't mean that we would do them better. It just means that it'll be different. Now, I'm not saying that we shouldn't correct a misdiagnosis on the part of a resident. That is a job that we can do and should do. Remember that we probably don't have the same level of expertise as the people below us on an organizational chart. You know, they're doing jobs that we may not have done for a while. The job may have changed and we probably haven't kept up for it. And I'll show how that can lead to really bad consequences later. Respect and care for others, and listen carefully to those that disagree with us, because they may be right and they will keep us out of trouble. I'd like to give you an example where great leadership saved my posterior parts. Now, it wasn't my great leadership, it was one of my bosses. We in VA were doing a smoking cessation trial, and the folks that were day-to-day in the trial decided that they would do an informed consent addendum. This was because a new drug had come on board, varenicline, known as Chantix, and it had potentially some side effects. So they wanted to make sure that patients were aware of these side effects of Chantix. Now, Chantix was not an object of the study. This was a strategy study, but nonetheless, they went and got this informed consent addendum. But there was no plan for follow-up. One of the veterans on this study drew his gun on his girlfriend and on the local police and blamed the trial. Conservative media had a field day blaming the VA. And Congress was beating up on us. The secretary was beating up on our organization, the then Credo, who was my boss at the time, Chief Research and Development Officer, ducked out of the way. And here's where I want to pay tribute to Mike Cussman. I offered to resign, and Mike said no. But he did create an administrative investigative board. Did this in a meeting I was having with him and the secretary and my boss. And I think he did it with the object of protecting me from the secretary who wanted to make somebody a sacrificial lamb. And when everything died down at the end, the undersecretary and his staff stood behind a counter of a cafeteria and served ice cream to the entire staff that was involved in dealing with this political issue, improving our morale, and obtaining my unending admiration for the way he took care of people. Now, clearly, this indicated some mistakes on our part. I had failed to assure that if we had deviated from established procedures, the chain of command would be notified. So we were surprised. And the informed consent addendum was a well-meaning deviation from procedure. Part of what saved us was that our Pharmacy Coordinating Center, which was under the great leadership of Mike Sather, was an ISO 9001 certified organization and subsequently received a Malcolm Baldrige Quality Award. By the way, only the second federal entity to ever receive this award. Of course, our response later was to bring this entire CSP into ISO 9001 certification. But in the end, Mike and Mike, the two Mikes, had really managed to do an awful lot to save a program that was under significant threat. Well, there are a couple lessons here. One, if you have the title, you are responsible. And I had the title, I was responsible. And I had not done everything that I should have done. And this didn't really come from this episode, but as a pragmatic matter, when we have responsibility, we should never cast blame on a subordinate, in my opinion. So one of the things about this experience is I look at Mike Cussman and I say, wow. And I think that one of the ways of becoming a better leader is to remember the times that we say, wow, when we watch somebody else. Watch what they do to see what works. I think, again, the three people that I mentioned at the beginning, Mike Steffes, Tony Colleen, and Deborah Powell, are well worth looking back and seeing what they did. So they were great leaders. Take time to think about the times we've done things right and the times we've screwed up. Remember that there's no right way to do the wrong thing. And when an important door opens, make sure everybody gets through it, not just us. Well, I'd like to talk about some more leadership mistakes on my part. I had a relationship with my boss at AFIP that deteriorated over time, and it became personal for both me and for her. The result was that the situation deteriorated for others in my department. I did not do a good job here. And the lesson is that it's never about us as a leader, it's about the organization. And we need to not let our personal issues get in the way of what's good for everybody else in our organization. A second leadership screw up. I arrived at VA and I was immediately told that my part of the organization had overcommitted its budget by about 10%. Thanks a lot. I solved the issue without involving the field. I did not discuss outside ORD. We resolved the budget problem, but it undermined the relationships with the field. We improved those afterwards, and we got along quite well over time. But the lesson from my wife's rules, Diane's rules, communicate both ways early and often. I didn't communicate well, and it hurt and slowed down my development as a leader within VA. Now, sometimes you're not going to be able to figure out what you should have done differently. I took over the cooperative studies program, our clinical trials program, and found that a previous director, who was, by the way, a stellar leader, had decided to close two of the coordinating centers. We had 5 clinical trial coordinating centers at the time. And the problem was that one of these was in the state of Maryland, and the Senate Appropriations Committee chair at the time was Barbara Mikulski, a senator from the state of Maryland, and she'd gotten wind of this and was not happy. It's not a really good idea for any federal agency to make the chair of the Appropriations Committee unhappy with you. So I got the brilliant idea that we didn't want to undermine the leadership of my previous director. We didn't want to mess up with the Appropriations Committee, so we would recompete all of the coordinating centers to give them an opportunity to basically apply to be a coordinating center. And we also opened this up to others. And so we had several other places compete for coordinating center positions. I figured in the end, the ones that were already there would probably do okay. And I was right. They all were evaluated very, very highly by an external evaluation committee. But we did ultimately decide not to close the 2 centers that had been slated for closure. And I thought this would make them happy. It wasn't. It didn't make them happy. It didn't make anybody else happy either. And I have no idea of what I should have done in this situation. But I will say that you can do your best, and your best may still sometimes prove to be not good enough. Now, I'd like to talk about leadership failures, and I said you should never do a job below your pay grade. And this is maybe one of my most important rules. And I'm going to give you a story that many of you probably know, and those who are younger probably don't. Boyce Choley was an engineer, and we may recall that the Challenger blew up on the launch pad or just after launch. He said, we all knew that if the seals failed, the shuttle would blow up. And there was concern because the launch was occurring in very cold weather, and the seals had not been validated at this level of cold. Sounds a little bit like validating a clinical laboratory test, right? We don't report results outside our validation range. Well, at first, the Thiokol managers agreed with them and formally recommended a launch delay. But the NASA officials on the call challenged that recommendation. I am appalled by your recommendation. And, when do you want me to launch? Last April. Right, you might recall there was a teacher on this, Ronald Reagan, I think, was the president, and he was very, very gung-ho to make a political statement with the Challenger launch. NASA overruled the Thiokol engineers and told Beaujolais and the others, take off your engineer hat and put your management hat on. Wow. That cost a bunch of lives. Thiokol is now called ATK. They had to change their name. Now, I'm going to apply the 7 rules from Steve Covey. Were they proactive? Yes. Did they begin with the end in mind? Yes. Did they put first things first? No. Did they think win-win? Have no clue. Did NASA seek to understand? Clearly not. Did they synergize? No. So these rules are really, really useful in management and in life. And I would really encourage people maybe to read the book, and no, I don't get a kickback. And at least to think about these rules as they approach their daily lives. So some management fails. One is, I think, failing to heed these 7 habits, these 8 rules. Another is to believe our own press. I don't know what it's like at Minnesota. In the federal government, we always had to write a very long list of our accomplishments. And then our boss was supposed to do something from that. In many cases, your boss asked you to write your own performance evaluation. You want it to look good. You're creating your own press. And you have to look at yourself and say, is this really true, or is my paper better than I am? I think a lot of times our paper was better than we were. We should never believe our own press. Believe you know other people's jobs better than they do. Usually a mistake. That's what happened with the Challenger, and we see what the outcome is. The fact is, I used to look at a lot of gastrointestinal stromal tumors and, have some really highly cited papers on the topic. At the same time, I think I would want my gastrointestinal diagnoses to be done by somebody that's been doing GI pathology over the last 15 or 20 years, not me. Believing that we're smarter or harder working or more energetic or inserting your own positive here than others in your organization. We tend to see ourselves in a positive light. We don't always see all the strengths in everybody else. Failing to have people that are not afraid to tell you when you're full of manure. And failing to remember that at some level your subordinates are probably afraid of you. And this is a real challenge as a manager. How do you have somebody that's probably a subordinate in the organization that's willing to tell you when you're full of manure? In a minute, I'll tell you the story of somebody, that great leader, that was good at that. And that's Bob McDonald. So Bob McDonald became VA secretary when VA was being beaten up pretty badly by the press and White House at this time about how long it took to get an appointment for care at a VA medical center. And he had a lot of experience as a senior manager. He had been president and CEO of Procter and Gamble, a fairly notable American corporation. And among the first things he did was to downgrade every single senior official performance level, 1 level from what the Undersecretary for Health had recommended. This made a lot of people, myself included, fairly unhappy. He met with the VHA National Leadership Board, these are regional directors and some of us from central office, and said he wanted to have adult conversations about VHA issues. And he said he wanted people to be honest. And so at this point, I was eligible for retirement. I loved the job. I didn't need the job. And so I brought up the evals towards the end of this meeting. They were clearly on everybody's mind, but since I could afford to be fired, I was the one that finally spoke up. I was hoping somebody else would, quite frankly. Bob accepted the criticism. He never objected to hearing it. And in fact, over time, we had a lot of interactions and they were quite positive. And we're friends now and have stayed in touch over the years. His willingness to accept criticism from a subordinate was a model that I think all managers should be willing to follow. It can hurt sometimes, but it can make us a better leader. Great leaders, here's some quotes. They've been seized by their followers. You know, organizations choose managers and give us titles and things, but they don't create leaders. Followers choose leaders. You know, Martin Luther King didn't become a leader in the civil rights movement because people were choosing him or electing him or in some way or another anointing him, but people heard a voice that they wanted to follow. And as, so he was seized by his followers. Great leaders have followers who become leaders in their own right. And I think you can see that in the careers of Deborah Powell, Tony Colleen, and Mike Steffes. When leaders leave or retire or die, the organization recovers quickly. One great leader that I learned from was a general who said, the most important job you have as a leader is to train your followers to do the job that you're doing now. Now, he didn't necessarily mean exactly the same job, but he was suggesting that if a general was interacting well with his colonels, that it would be preparing them to take general officer positions someplace else in the military. And that is the same thing that we're called to do. If you are a department chair, you may hope that some of the folks that are in your department now go off and take leadership positions in other ways, whether that be professional organizations or leadership of other departments. And, you know, then when you're really fortunate, some of them go off and they, you know, become deans and maybe university presidents and in some sense eclipse us. I think Lao Tzu has it right. A leader is best when people barely know he exists. When his work is done, they will say, we did it ourselves. Wow. Please remember that leadership and management are team sports. Now, I've been talking about leadership and I've not been talking about management, and that's for a very good reason. I am a terrible manager. And so I know a lot about what it takes to be a decent manager, and I don't have those strengths and weaknesses. But Andrew Carnegie noted that whatever success he had was due to his ability to surround himself with people who were smarter than I. I think it's really important that we be able to recognize and admit our weaknesses and take advantage of other people's strengths. I apologize for my typo, but when I succeeded as a leader, I've told you many times I failed, and most of the time it was because I wasn't listening to others. But the times when I succeeded, it was because I was supported by people who are better managers and sometimes better leaders than I am. And part of this is to respect and honor all people. You know, Augustine, using the language of his time, stated that it's a sin to judge any man by his post. Now, this is probably controversial, but I would argue that the higher you are in an organization, the less power we really have, because our success depends entirely on the success of the people that are, quote, beneath us in the org chart. So the job of the leader is to remove the barriers of success and implement systems that facilitate success. Yes, we have power in a sense. We can choose those people who are going to be in that org chart position. But that's the limit of it. You know, if you are in the clinical laboratory and head of clinical laboratories, you are absolutely dependent on the success of the med techs and the phlebotomists and everybody else in the organization that's actually, where the rubber meets the road. And if you say jump and they all wander off, good things are not going to happen. Any issues here? So back, as I said, this is a meandering talk. It goes back and forth. Discover your passion. Dr. Powell did this. She thought she might become a pediatrician or an internist before she became a pathologist. She probably didn't ever think about the time becoming a pathology chair or a dean. Try to work on something important. I had two thesis advisors when I was doing my PhD. One of them was John Brauman, and John Brauman was a great physical organic chemist. Became a member of the Academy and ultimately received a National Medal of Science for what he did. And his advice was to try to work on something important. He did. He was recognized for it. And I tried to do the same throughout my career, perhaps with less success than John or my other advisor, Art Shallow. Dr. Powell worked hard to change medical education from a time-based to a competency-based system. I mean, I think it's a hugely innovative idea. I think it's a great idea. It has yet to fully take hold. We have to be willing to accept full responsibility for failure, and we'll veer into professionalism here. A pathologist should be honest in all professional interactions. Well, sometimes we fail, and we need to blame ourselves when it's our failure, not somebody else, not the system. Be trustworthy. Now, trustworthy is an interesting concept because it means honest, yes, but it also means competent. Okay. An honest surgeon that doesn't know how to operate properly, can't do an appendectomy, for instance, and starts on doing an appendectomy, is probably not a trustworthy person. So our obligation as pathologists is to not only be honest, but to be competent and to know the limits of our competency. I think we need to seek forgiveness quickly and sincerely when we've hurt someone, whether or not intentionally. And, I think all of us hurt people sometimes. Usually it's unintentional. And it's very easy to say to ourselves, well, I didn't mean to do that, or I was misunderstood, or they shouldn't have taken it this way. But the fact is that we delivered the insult, whatever it is, the injury, and it's our job to rectify it. Similarly, when we're hurt, we need to offer forgiveness freely. We shouldn't be sparing because there's more where it came from. And this business of offering and seeking forgiveness, I think, really, really important leadership skills that people don't often talk about when they talk about leadership. Give thanks and credit liberally. I think this is really, really important. It's very, very easy. In fact, it happens all the time when you lead something that somebody will hand you the credit for work that was done mostly by people around you. And I think when you share that credit, the people around you that are really doing the work, they notice and they appreciate it. And it can make for great team interactions. And on more than one occasion, my posterior parts were saved by people whose loyalty to me personally was driven, I think, in part by the fact that I gave them credit where credit was due. And then every opportunity denied is an opportunity given. There's some things we just don't get the opportunity to do. Maybe we want a job someplace else. Maybe we want a promotion. But each of those gives us a chance to look at other opportunities. And sometimes those things are really good. I saw that my institution, which I loved, the Armed Forces Institute of Pathology, but it wasn't going to survive. And I moved, and I moved to VA. And when I moved to VA, I found myself in the most wonderful series of jobs that I could ever have expected, learning things I never expected to learn. Pushed out of my comfort zone, certainly, but it was an opportunity given. And finally, remember that life is a series of accidents, and none of us succeeds purely a result of our own intelligence, skill, or effort. And perhaps at the end, I'll tell a story of some of that in my case. Well, how does this come and dovetail with professionalism? Dr. Colleen asked me to please, bring the professionalism into this. And at first, I really scratched my head. And to a degree, I'm still scratching my head. But I'm going to just go down what CAP has to say about professionalism, the College of American Pathologists, and map it into Stephen Covey and others. He says that we should maintain practice of compassion, dignity, and respect. Put first things first. This is the first thing about being a physician. And before we are pathologists, we are physicians. We are called upon to heal. And we cannot heal effectively if we don't respect. We have to put the interest of the patient foremost. Again, put first things first. We shall maintain professional competence. Sorry, I must have. What happened here? There we go. Maintain professional competence. We need to study. We need to keep up, I think, not just on pathology and what we're doing in our individual disciplines, but also on medicine in general. And yes, for those of us that are not as old as I am and don't have time unlimited board certification, we do have to go through the maintenance of certification exams. But, face it, it's a pretty low bar. And at least I've thought that they were. I do take those exams every quarter. And I think we're called upon to do more than that in terms of maintaining our professional excellence. We're called upon to try to be better than we are every single day. Okay, again, we obviously cannot be somebody who jeopardizes patient care. We need to put first things first. We need to do timely reports, but more importantly, seek consultation where appropriate. This was the wonderful thing about being at AFIP, of course, is I had great consultants in almost every area of pathology available. And if I didn't have the answer to a question, they would at least have a better approach. Now, the wise ones among us, we learned that we would offer an opinion on the diagnosis because sometimes we too would prove to be wrong. And I think that humility was something that they taught very, very well at AFIP. And I think that we need to teach as well as we deal with our residents and fellows. Pathologist keeps confidentiality, be trustworthy, we should contribute to public health, we should be generous, and we should respect the law. I think the differences here from ordinary leadership skills are small to none. So I think leadership and professional competence really come down to the same thing. I was also asked to talk about uncertain times. And I thought about this a whole lot because, we talk about the fiscal uncertainty now, we have political uncertainty, and certainly those of you in the Twin Cities have been dealing with very challenging times. And I'm sure there are heterogeneity of views here and considerable tension from time to time. But all times are uncertain times, you know. And Don Rumsfeld, who was Secretary of Defense, not my favorite guy, but he had what's called the Rumsfeld matrix. And the point is that we have this very small group of known knowns, the things we understand, and then we have all the things that we don't understand. And there are many more things that we don't understand. And then I had a colleague, Bob Becker, another pathologist, who used to say, you know, it's not what we don't know that hurts us, it's what we do know that just ain't so. And that is, I think, a challenge for us as well. In my nearly 50 years of practicing medicine, since it's, a lot of what I was taught turned out to be wrong. Now, you mostly we hear that lecture in medical school, the one that says something to the effect of, half of what we tell you is going to be wrong. The saw is to change that so that we find out which half of what we learned as a medical school student or a resident or whatever actually isn't so and what so is. Now, when all times are uncertain times, we can predict the future as long as we help to invent it. And again, Tony Colleen and I, to some extent, and others that were early on in molecular diagnosis, sought to invent the future. And we could predict it to a certain extent, but I never would have predicted that we were doing whole genome sequencing for, a few $1,000s clinically by this time. So we are imperfect in our foresight. Leading change. We do have to change. All organizations change. They change whether we like it or not. We want to change it in an orderly way. I think there are 4 rules. Understand what our core responsibilities are, because most of us that are leaders are still reporting to somebody else and they think you have a job to do. We need to align the possibilities with our passions, and we need to be patient because it never goes as quickly as we think it should. And I'll give you an anecdote from molecular diagnosis. In late 1980s, a certain Midwestern university invited me to interview for a faculty job. I was told I should give up on working on molecular diagnostics. It lost money and wasn't ever going to catch on. I didn't move. Molecular tests are now $8.4 billion of Medicare spending. And so they became pretty important. The university eventually had the wisdom to hire the man that's now your chair, but it didn't have the wisdom to do what was necessary to keep him. Don't be afraid to dream. Managers make sure the train's on time, and effective management is really, really important, and a leader can't be successful without it. Some people can do both. I can't. You need people that can, when you have a dream, you need people that can build a foundation. They generally require expertise that you don't have. So there are things that you need to do to make that happen. I had an opportunity to organize an effort which we became known as the Million Veteran Program. And we started this in 2004. Nobody else heard of it in 2004, but we started it in 2004. And it took 5 years to set the groundwork, doing surveys of veterans, convincing congressional committees, convincing people within VA that this was something that was worth doing and could be done. It was largely a vision of John Perlin, an undersecretary at the time. But in spite of that level of support, it took us a long time to get it ready. In fact, it took 5 years to even have the first meeting to move the project forward. We didn't recruit the first subject until 2011. When I retired officially, we had recruited 440,000 people to participate. So setting the groundwork was really, really important, but it was also much more time consuming than actually organizing the effort. Now, there's now over 1 million participants. Leadership didn't all come from the top. It didn't come from John Perlin particularly. It didn't come from me particularly. Yes, we had an important role to play, but it was built on a pre-existing foundation, the VA Cooperative Studies Program, which had existed 20 years before we were. It needed the support of veterans and political appointees, and it needed people throughout the organization to figure out what was going to make this work at their medical center, what was going to be required to make it work at the two coordinating centers in Boston and in West Haven, that were going to have the hands-on machinery to make this work. And there's leadership at every level of the organization. And without a team, this sort of thing doesn't happen. No VA secretary, no chief research officer could ever make this happen. Now, sometimes, as with MVP, we succeeded, but sometimes all leaders fail. And I'd like to consider my thesis advisor, Art Shallow. Now, he had an early contribution, which was a paper in the Physical Review entitled Light Amplification by Stimulated Emission of Radiation. And it was viewed as a solution in search of a problem. Now, this was a theoretical paper. It took several years for somebody to actually show this worked. But even then, after the first devices were built, it was a solution in search of a problem. Some people called it hobby science. He loved jazz clarinet, but he wasn't good enough to become a pro. The highlight of his postdoctoral experience was meeting his advisor's sister, who became his wife. That is putting first things first. When I asked if I could join his research group, he asked if I had my own money because he couldn't get funded. He was a member of the academy at the time. And try as he might, he couldn't help his autistic son lead an independent life. He did become chairman of the physics department at a small West Coast university, president of the Optical Society of America. He had a postdoc that got a Nobel Prize in physics. His solution found to a problem found more than one, and now the laser's no longer a loser. By the way, that was his title for it, loser. And he got the free trip to Stockholm. One of the projects he worked on for helping autistic children is now widely employed, and my wife, my daughter, who's a special education teacher, uses it routinely. And he donated his Nobel Prize. So I've talked about some characteristics of leaders, but each of us has a perspective born of our own lives. You need to be you. Nobody can be me. I had a set of experiences that are unlike anybody else's, and so does Tony, and so did Deborah, and so does Mike. But you need to be the best you can be, and you can do that by studying some of the people you got in Minnesota. I mean, you have a lot of, I've mentioned 3 of them, but there's scores of great leaders at the University of Minnesota. And there's great leaders in your population as a whole. Whether you object to ICE or you don't object to ICE, the people that have been out there demonstrating are showing amazing leadership. If you can, Rudyard Kipling has a poem, it's called If, and I will just go to the last line. If you can meet with triumph and disaster and treat those 2 imposters just the same, that's wise. So Stephen Covey gave us 7 rules. I'm going to add 3 more habits that I think are important. Maybe my ego is getting in my way here, but be trustworthy, be humble, and be generous. Every great leader I've seen has been trustworthy, humble, and generous. And that is something all of us can try to emulate. We need to look in the mirror from time to time, think about the good, the bad, and the ugly of what we've done. And sometimes you're going to look in the mirror and say, you dumb, insert whatever expletive you want here. And unless you do, you're probably not doing a very good job. And you're going to make mistakes. Some of them may be mistakes to die for, and don't pick yourself up. Treat the disaster just like the triumph the same. I'd like to offer some acknowledgments to many of the people that have taught me about leadership. There have been colleagues, there have been people I've worked for, there have been people that sort of worked for me. There are many, many great leaders out there, and I only scratched the surface with this very, very long list. I suggest some reading, and this will be available for you to see later, I think. Some web resources, and I think my wife, whose leadership skills really are exceptional, I would recommend looking at those two. And then I will end the share. And if there are comments that people would like to make, complaints, criticisms, I would like to welcome them, because I can use all the help I can get in getting better. Thank you. I do see one hand up from Dr. Crossan.
John?
Dr. O'Leary, thank you so much for that discussion. Many people in medicine right now feel that the healthcare delivery system is broken. And the question I would like to ask you is, to what extent do you think physicians should be involved in politics?
Well, this is getting very personal. I think it's really important that people from every area of life be involved in politics. One of the great things about early America, and I'm not a historian, but I've spent a lot of time reading, is that we had people that, certainly a lot of lawyers involved in framing up what became our United States, but people from all walks of life. And I think we need people from all walks of life in politics. I think that we have insights that are very, very deep and personal, not only about the way the medical care system or medical care business model is organized, but also in what are the real issues that people deal with on a day-to-day basis. And look, it's gotten a lot harder in the era of the 12-minute encounter in which you can deal with maybe the chief complaint. This is hard, but over time, one develops relationships with patients. Maybe less so as a pathologist, but then we understand the relationships with physicians. And we have something to offer, as do carpenters, as do plumbers, as do teachers, as do English professors. And I think I would love to see all of these folks become involved in politics, because only when all of us own the system will the system respond to us. You know, this is my personal belief. I may well be full of it.
Are there any other questions from the attendees? If not, I had just one question, speaking as a program director. Two questions, actually. One would be, what would be your advice for residents and fellows who are just kind of starting their career? I'm coming at this from the perspective that, is leadership looking at the rules that you presented, is leadership something that, like happiness, comes to you if you don't directly pursue it? i.e., has leadership become something that, because it's part of our curriculum now, that it's something that we have a tendency, even as a program director, to check the box and say, yes, you are advancing in, such a, with rapidity, or, with progressing adequately along the spectrum for leadership. I mean, we can certainly encourage things like becoming active in CAP, participating as junior members, as, members of teams doing inspections, but is it something that we're seeking too much?
So I don't think of leadership as the business of being boss. I think leadership is the way we live our lives. I had these two pieces of it, and part of this is how we are. So leadership is doing what we can do to make the world better, to make our departments better, to make our patients' lives better. And for some people, that may be because by taking an administrative role. But for some people, it may not be by taking an administrative role. It may be by doing something else. But that doesn't mean that you're not a leader. Albert Einstein was never a person in an administrative role. He led before he became a popular figure by reinventing a piece of physics. He did some, pretty cool stuff. He became well known and then took that into an influencer role, which was leadership. And we all have the opportunities, and I would say the obligation, where we have insights to try to influence. And one of the things about Bob McDonald's great leadership as a VA secretary is he sought that input from everybody. And so, yes, I think we need to teach everybody to be leaders, but they don't need to be department heads or division heads. They just need to be they need to be really good pathologists, and they need to help us advance our field.
Which dovetails with the rules that you started out with.
Yes, absolutely. I think, leadership is for everyone. How do we make ourselves better?
Well, that's a great note to end on, and one that I think reflects very well on Debbie Powell.
And I want to thank everybody for tolerating me for the last hour. Thank you.
Thanks very much for joining us, Dr. O'Leary. Very much appreciated.
Take care, and
Thank you.
best to all of you.